All right, this is take 2 for chapter 20 because my daughter just came in and talked for the last 20 minutes about choo-choo trains. So here we go. So this is the aorta. Remember, the aorta is where that oxygenated blood is coming out of the left ventricle of the heart. Okay, so let's talk about where it's going, right? So it comes up through the ascending aorta. We are going to go to the heart. So the right coronary artery and the left coronary artery are going to send that oxygenated blood in back to the heart, right? But then we have to take that oxygenated blood out to the rest of the body, okay? So coming up off the top of the aortic arch is the left subclavian artery. That left subclavian artery is going to go down under, sub means below, like submarine, and then clavian is your clavicle. So it's going to go down your left arm under the clavicle. The left common carotid is going to go up and oxygenate the left side of your brain. Okay. Then your brachiocephalic is going to split into the right common carotid to hit up to the right side of your brain. And then the right subclavian is going to go under the right clavicle down through the arm. Then we have the descending aorta, and the thoracic aorta is going to become the abdominal aorta. Okay. So let's take that carotid up through the brain. This is the right side of the brain. So you can see this is that common carotid coming up, and we're going to begin to split. Here's that external carotid artery, okay? And that's going to hit sort of the outside of the head. It's going to start to split, as you see. It's also going to split into the internal carotid, which is going to split inside. Here's that internal carotid right there. Okay, and it's going to go inside the brain and feed the circle of Willis. We're going to talk about that in a second. Okay. You'll also see right here is the vertebral artery, which goes up through the vertebrae. So this is that circle of Willis, and this is the blood vessel pathways for the brain itself, okay? And so here are the internal carotid arteries coming up, okay? And then we're going to see the basilar artery, and there are those vertebral arteries that we talked about. They're going to go down, go through the vertebrae right here. There it is, right there, okay? Oops. There's the ophthalmic, which is going to go to the eyes. Here's the anterior communicating and the anterior cerebral. There's the posterior communicating and the posterior cerebral. Now we're coming down the torso, so there's that aortic arch again, right? And we're going to come down through the thoracic aorta, okay? That thoracic aorta has some branches coming off of it, like the bronchial, which is going to go to the bronchial tubes in your lungs. The esophageal is going to go to the esophagus. The mediastinal is going to go through the center of the mediastinum between the lungs. The pericardial is going to go to the pericardial sac. There's that thoracic aorta coming down. Okay, and you can see we also have these intercostals coming off. Those go between the ribs. And then you have what's called the superior phrenic. Phrenic means diaphragm. So the superior phrenic is going to go to the top of the diaphragm, and then you have the inferior phrenic going to the bottom of the diaphragm. Okay. Now we see the celiac trunk, where we have the left gastric, the splenic, and the comic hepatic. Gastric is usually going to go to the stomach, splenic goes to the spleen, hepatic goes to the liver. Okay? You have your adrenal, which are going to go to the adrenal glands, and then the renal, which are going to go to the kidneys. You have the gonadal, which are going to go to the gonads. This is the superior mesenteric and the inferior mesenteric. Those are going to go to the intestines. And we're going to come and we're going to split into the common iliac. And they split right here at the iliac crest. So there's the common iliac. And then we're going to split into the internal iliac and the external iliac. So here are our thoracic aorta coming down, right? So we have the bronchial arteries, pericardials, esophageal, mediastinal, and then these are called paired because there are two of them. So you have your intercostals and your superior phrenics. Coming down through the abdominal aorta, okay? Here's that celiac trunk, which is going to split into the gastric, the splenic, and the common hepatic. right? And then we have our superior mesenteric and our inferior mesenteric. And then we also have our inferior phrenic, our adrenals, renals, gonadals, and lumbar. So that means that they're paired because they have two. And then as we go down through the abdominal aorta, we're going to split into the right common iliac, which is going to go into the right internal and the right external. And then the left common iliac does the same. It's going to split into the left external and the left internal. Okay? And so this is following that right subclavian, right? Here it goes under the clavicle, and then we're going to go down your arm. So we go through the axillary. Remember, axillary means like that armpit region. Okay. And then we're going to go deep brachial. So here's that brachial right there. It's going to go over sort of that, the brachial area of where you would find your biceps brachii. And then we're going to go to the radial, which is going to go to the thumb side, and the ulnar, which is going to go to the pinky side. So here you go. Here's that aortic arch. Okay. And so we are going to go on the right side. We get that brachiocephalic. The brachiocephalic is going to go into the right common carotid, and then it's going to go up into the circle of Willis in the brain. Okay. And here is your right subclavian, which is going to split then into the right axillary, the right brachial, the right radial. We're going to go to the digitals, which are the fingers, and we also have the right ulnar. Okay. And here you go on the left side. So we have that left common carotid going up to the circle of Willis. Left subclavian, okay, is going to split into the left axillary to go under the arm, left brachial, left ulnar, left radial to the digital arteries. Okay. Now, in order to come back up the arm, we would go through our veins. Okay. And so we would have to go through a capillary bed, right? So you could say like, finger or hand capillary bed. And then we're going to go back up. We're going to go through veins. We would appear veins as blue, right? So we could say left radial, left ulnar, left brachial, left axillary, left subclavian. And then we're going to go back into the heart through the inferior or the superior vena cava. In this case, it would be the superior vena cava. Okay. Now we're going to go down the leg. So remember we had our iliacs. So here's that common iliac coming down. We're going to hit that deep femoral. So there's that femoral going down the femur. Popliteal is going to go right by the knee. We have the anterior tibial and the fibular. And then we're going to go down through the dorsal arch. So we'll serve that here. Here's those X. We're going to go down the femoral to the popliteal at the knee. And then we have our anterior and our posterior tibial. There's the fibular. And then we're going to go down to the foot. Okay. Now, same idea is that we could have veins that are going to return us back. And so we would have to go through a foot capillary bed, and then we could go through the anterior or the posterior tibial, up through the popliteal vein, right? Those would be veins. So just imagine these as blue, through the femoral, through the external iliac, and then into the common iliac vein, and then up through into the inferior vena cava. Okay, so you can see those veins here and the arteries, right? And so the veins and the arteries typically have the same names. There's one extra vein here in the leg that we want to talk about, which is the great saphenous vein, and it goes all the way up your leg. Now remember that the arteries are going to go down, blood flow is going down, and the veins, the blood flow is going back up. So here are those the vein pathways, okay? And you'll see that they have the similar names. There's a couple of different ones. There's the azygos right here, and the hemiazygos right there. But most of the other ones are going to be the same. The difference here is that in the arteries, we have carotid arteries, but in the same places in the neck, we don't have carotid arteries or carotid veins. We have jugulars, okay? So we have the jugular veins right there. We have an internal and an external jugular. This is the hepatic portal system. Okay, and so here's that hepatic portal, and you can see that we have it going, it's going to go into the gastric area, which is the stomach. It hits all that mesenteric region. Here you go, the splenic and the inferior mesenteric. These are the veins within the head, okay? And so the blood flow is actually going to go through come back down to the heart from here, okay? So you can see there's the temporal coming off the temporal area, okay? Now inside you have sinuses. You have the superior sagittal sinus, the inferior sagittal sinus, the straight sinus, okay? There's the cavernous sinuses, and they're all feeding into the sinuses within the brain, and they're going to come down through the internal jugular and into the superior vena cava. Now here we would have come down our arteries, hit the hand, and now we're going to be moving back up. Okay, so you can see there's the ulnar and the radial, the cubital, which is at the elbow, the basilic coming up, as well as the brachial. So remember, there's more vein names, artery names. And so you'll be able to follow this kind of all the way, just like we did with the arteries. Okay, so here's the hand. There's the ulnar and the radial coming up through the left brachial into the left axillary, that's under the arm, left subclavian going under the clavicle, into the left brachiocephalic, and then into the superior vena cava. Okay. Here is the blood flow coming into the inferior vena cava. So we have it coming from the liver, the gonads, the spinal cords, the lower limbs. Those would be our legs, okay? The pelvic areas, and the kidneys, the adrenal glands, and the diaphragms. So we'll see that blood flow coming back up the leg through the fibular, the great saphenous, the popliteal, the femoral, into the external and then internal iliacs. There's the common iliac. Okay, so feet, fibulars or the tibials into the popliteal. There's the small saphenous and the great saphenous into the femoral, external iliac. Okay, so take a minute and just compare the arteries, the veins, and the capillaries and just see what you come up with. And so what I would like you to do, you're actually going to be doing these paths. So you're going to trace the movement of red blood cell from the superior vena cava to the left coronary artery. So superior vena cava to the left coronary artery. So what would that mean, right? Is if we're going to be coming through the superior vena cava, okay, that we're going to be coming back into the heart. And that means that we have to go through our heart pathways, which you would have gotten, I think, 2 lectures ago. So you have to go into the heart through the right ventricle, into, the right atrium, the right ventricle. Then we're going to pump it back out to the lungs, come back into the left atrium, I'm simplifying here, left ventricle. Then we're going to come and pump out through the aorta. And when we come out the aorta, we're also going to come out through that left coronary artery. So we can be able to then hit the heart. Okay. The movement of an oxygen molecule from the aorta to the medial aspect of the cerebral hemisphere. The cerebral hemisphere is, hopefully you know this, in your brain, right? So if we come out the aorta, we have to be able to get to the cerebral hemisphere. You have 2 options here because we're going through the center of the brain, right? And so when we come up, we can come through the common carotid, right? Now, how do we get into that common carotid? Well, we can go up directly into the left common carotid artery, or we can go into the brachiocephalic and then the right common artery, okay? So then once we come up, we're going to go through the internal carotid, and we're going to come up through the middle cerebral, into that circle of Willis, into the middle cerebral artery to hit the center of the brain. Okay, so a patient that receives 5% glucose IV into his left basilic vein. So where is that left basilic vein? It's in the left arm. Okay. Trace the flow of the glucose from the vein where it is utilized by the muscle cells in the right biceps brachii. It'd be really easy if we could just go from the left vein into the right biceps brachii, sort of straight across the body. And we technically do that, but we have to go through the heart into the lungs and then back out first. So take a little bit and see if you can do that on your own. Another one is to trace the blood from a pulmonary vein to a popliteal vein. See if you can do this. Hopefully the games that you're creating for one of your minutes will help you with this. If you have any questions, you know where to find me. Hope you guys are doing well. Thanks. Bye.